Right, so this morning the head committee we want to create an awareness and sensitization on Larsa fever. How many of us have heard of Larsa fever before? Let me see your hand if you've heard of Larsa. Okay. Who can tell us what Larsa fever is? Any volunteer? I will point somebody. Any volunteer? Yes, sir. Thank you.
It's a disease you get when you eat rat.
Thank you very much, sir. Yes. He's somehow correct. Thank you very much. Now let's move to we don't have time, so I'll try to be very snappy. Now the essence of this sensitization and awareness is for us to know that there is a problem we have on ground and what we need to do to ensure that we don't fall victim of it. Because it's something that is very deadly, very fatal, and we thought it was important that we should bring this awareness to church so that we can know what we need to do to prevent any of our members or any of us coming down with this, what is becoming like an epidemic at the moment. So the media, please, can you move to the next slide? So this is the definition of Larsa fever. Larsa fever is a zoonotic disease. That is, it's an animal-borne disease that is caused by the Larsa virus. And it affects almost all the organs in the body. It is transmitted by the multi-mammate rats. That is, those rats that have plenty breasts, known as Mastomys natalensis. Those are in biology and the likes. I'm sure you've come across this. The rats themselves don't have any symptoms of the disease. They don't fall sick. They are not affected by the Larsa virus, but they can spread the virus through their feces, urine, saliva, or blood. Next slide, please. Now, this disease is becoming endemic or epidemic. Endemic in Nigeria. It has been endemic for a while, and Benue State is particularly a state of concern. As of this month, almost 10 people have already died from this Larsa fever from here. So it's a disease that is something that we must take very seriously. A lot of times, when you begin to have some of those symptoms and it is not treated, you can die very fast. Now, this is the rat. I'm sure you can see it. Not very clear on this. But some of those rats that you see in the house, if you catch them, you see they have a lot of breasts. They are the ones that transmit the disease. Let's move on, please. Let's move. Next slide. Now, how does this Larsa fever spread? Like I said, these rats are the primary organisms or people, the primary people that, why am I saying people? They are the ones that are responsible for spreading this Larsa fever. Now, it suffices to say that if you don't want to have Larsa fever, what's the best thing? Is do away with the rats, right? If you do away with the rats, it means there will be no Larsa fever. Now, but because we cannot do away with all the rats, and you know we're in an environment where a lot of us like to eat bush rats, so how does it spread? It spreads through contact with saliva, urine, feces, or blood of rats, like I said earlier, by eating food or drinking water that has been contaminated by the saliva or the blood of these infected rats, by touching household objects that have been contaminated by these rats, by inhaling air that contains small particles of saliva, urine, feces, or blood infected by the rats while we are cleaning, and by person-to-person contact through saliva, through secretions, blood, semen, or infected person. So what it means is that if you come in contact with someone who has been infected through blood, through the person's saliva, even through air droplets, even through sexual activity, you can come down with Larsa fever. Please, the next slide. Who are the people that are infected? Everybody can be infected. Each of us sitting down here, we are at risk of coming down with Larsa. Whether you are a child, you are a pregnant woman, you are a man, you are a woman, you can come down with Lassa fever. So it concerns all of us, both young and old. Who are the next category of people that can be infected? Those that live in very dirty environments. So if your environment is dirty, it's not well kept, then you stand a high chance of coming down with Lassa fever compared to someone who lives in a very clean environment. People who practice poor storage of food. People that dry food on the road. So you see when you are traveling, sometimes you see on the highway, a lot of people dry this gari and all those things by the roadside. They are at risk of coming down on Lassa. Burning bushes. Family members of those that are taking care of individuals that have come down with Lassa fever. Now, those of those that are commonly infected and mostly affected are doctors and of course health workers, those that work within the hospital environment that take some of these patients. Of course, those that work in the lab as well. So can we move to the next slide? We don't have time. Now, what are some of the symptoms of this Lassa fever? If you look at that picture, I don't know whether it's clear. Headache. Now, most times people confuse it with malaria. So you have fever, you have headache, you just assume it's malaria. Sore throat, back pain, chest pain, cough, general body weakness, vomiting, fever, diarrhea, stomach pain, swollen face, redness of the eyes. You can see that the symptoms they are just plenty. And sometimes they look like they are vague. Now, what that means is that if you have a headache, or a fever that is not resolving, you've taken anti-malaria, maybe you've completed one dose of anti-malaria, and you are still having headache, you are still having fever, and you think maybe you might be exposed to food that has been poorly stored, you may need to visit the hospital for a check. Let's move to the next slide, please. What are some of the complications of this Lassa fever? It can make you to become deaf. It can cause seizures. It can cause hypotension. Even for pregnant women, it can cause spontaneous miscarriage. Of course, it can cause what we call encephalitis, that is infection in the brain, and then fluid in the lungs, and ultimately it can lead to death. Next slide, please. Now, is there any treatment for this Lassa fever? Yes. If it is detected early, it can be treated. There are drugs that we can give you and can treat it. However, there is no vaccine for it yet. So there's no drug that you can take and to prevent it from coming down with it. That's why we need to ensure that we employ preventive mechanisms to prevent us from coming down with this Lassa fever. Next slide, please. Now, this is where I want to dwell because this is the crux of the matter. So I would spend most of the time on this slide. How to prevent Lassa fever. Now, I said that Lassa fever is a very fatal disease. It's a very deadly disease. It's something that can kill within 48 hours, it can kill someone. So for us to ensure that we don't come down with what are the things that we need to do? And I highlighted those that are at risk of coming down with it. We talked about the primary causative organism, which is the multi-mammate rat. Now, the first thing is to set traps that can kill these rats. If you're in an environment where there are a lot of bushes, you need to clear those bushes. You need to stay in a clean environment. You need to ensure that the environment that you are staying, these rodents are not found there. If you are in a house that has a lot of rats, then you may need to start setting traps to kill these rats. You may need to go and buy rat poison to kill the rats. The next thing is that you should not touch dead rats. If a rat dies in your house, don't go and use your hand to hold it. Get a packer, a broom or something, get it and throw it outside. Possibly burn it. Avoid eating food that has been exposed to these rats. So sometimes we see that you keep something, the rat will come and bite one portion of it. Once you see that, don't eat it. Block all holes in the house. And some of us stay in buildings that there are a lot of, holes. There are spaces where rodents can enter, flies and all those things. We need to block all those holes. Look for a way to block all those places. Food storage, very, very important. Now, we advocate that food should be stored in things that can be neatly closed. You can get containers that you can close can get buckets that can be closed, jerry cans that can be closed to store food so that rats don't have access to these things. Do not dry food on the road, on the ground, outside. Cook all foods properly. So, avoid eating food that is not properly cooked. Of course, I've talked about cleaning of your environment. Then avoiding direct contact with those that have been infected. Proper disposal of waste. Oh, sorry. Now, where I want to dwell on before I finish, this is the last thing. Please, the next slide is personal hygiene. Personal hygiene is the single most important preventive measure for Lassa fever. If you just stay clean and neat alone, you stand a higher chance of never coming down with Lassa fever. And what is it? Proper hand washing. Because of time, it's not very clear on this. But I wanted to demonstrate to you how you wash your hand properly. And I will just do that. Please, help me with this mic. Thank you. Please just watch me. Now, we advocate that you should wash your hand under running water. What it means is that even if you have somebody with you, the person can pour. So let's assume you went out, you came to church, you shook so many people, and you are back to your house. The first thing you need to do before you touch anything in your house is to wash your hand under running water. If you don't have a tap in your house, somebody can fetch and pour for you, you pour for the person. Now, this is what you do. You put soap. You can start with this. You wash like this. Can you see me? Wash this way. You wash this way. You wash this way. You wash this way. You wash here. You wash here. You wash like this. Then the thumb. You wash this way. You wash. Third step. Fourth step. Wash. 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 Rinse. And dry. Thank you very much.